And we are back with certified sex therapist Emily Diala and her father, board-certified OBGYN Dr. Rafael Diala. All right, we had gotten a call that dropped during the commercial break, and the woman was asking, she said, the problem is her husband lasts too long, and what can she do to speed things up? It's kind of like you got to put up a no camping ground sign. You know, so that oftentimes timing is something that needs to be worked out sometimes.
Timing is an issue for a lot of couples. You see these, couples, making love on TV, and it's like everything is simultaneous, and people expect that that's the way it should be, but that really isn't the case for most couples.
Yeah, it's like, what do you mean you're done?
Right, exactly. So, especially for men, whether they're having premature ejaculation or delayed, which is something I'm actually seeing more and more of, I encourage them to kind of develop their arousal continuum, which is developing an awareness of what things maybe aren't quite as arousing to them versus what types of things really get them going. And, you can kind of tailor what you're doing to kind of fit on that continuum so that both partners feel mutually satisfied.
And at the end of the day, women are generally, we're made a little bit differently.
It's true.
And so it may take different things for us to get there.
Absolutely.
Timing is everything.
Yeah, timing is everything. All right, we have an email question from Sally, and this is about something that we had on the show yesterday in our Medical Monday. I saw on your show about the new birth control for men. I've been dating my man for several months, and I'd like him to get on that. What's the best way to bring this up? And what it is an injectable gel that is reversible. But it was funny, we asked this on our Facebook question yesterday, and almost everybody was like, absolutely not. Good luck with that one. And we also said, would you suggest that maybe your single sons would get on this? And people were just like, really? But I think in society, we still have the onus is on the women to have birth control.
I think so. I definitely think there's a gender stereotype. I mean, we're still, research is still being conducted to see, just how birth control pills and oral contraceptives can affect, a woman's hormones later on, and so, but there's no hesitation for a lot of women to still get on the pill. But I think for men, if there's something that could in any way potentially affect their ability to produce sperm, it's like an automatic reaction, which I don't really think is fair.
Yeah, so it does take a little...
It's a virility issue. It's a, I don't want anything that affect my manhood, so to speak. So.
All right.
Unfortunate, but true.
Like we said, if people take hold of that gel, the Maury Povich show will be canceled. All right. Diane is on the line. Good morning, Diane.
Yes.
What's your question?
I have a question about my husband. He hasn't been able to have sex in like 6 years. He has multiple sclerosis. Is there anything that he can do?
So having MS, and so a disease state like that can cause problems that can be permanent sometimes, and sometimes...
That's true. I've actually worked with several people who have MS because it can take a toll on your sexuality. I always encourage couples to kind of rewrite their sexual script, because the sex you have maybe at the beginning of a relationship is going to be different than that 5 years in, during pregnancy, after the kids leave the house, and especially after going through some kind of, having some sort of disease or something like that. So, if you're willing to kind of make those changes for those other reasons, there's no reason why you can't, make the adaptations, and it can be an opportunity for growth.
Yeah,
I mean,
and I guess the thing you also have to figure out, is it a psychological moment or is it the physical moment, which is what you do in your office.
Yeah, a lot of times it's a combination, and if there is a physical block, that doesn't mean, that there aren't plenty of other things you can do to still feel, a sensual connection, an emotional connection to your partner that may be different than what you've done in the past.
Yeah.
Experiment and communicate.
Yep, that's the key.
All right. Monique, good morning, Monique.
Hi there.
Hi, what's your question?
I have a very difficult time having orgasms. It takes me a long time, but I haven't told my husband. He's patient with me, but the way I do it is that I have to think about a threesome or having a man with a large penis or more different men in the bed with me. That's how I have orgasms.
Well, page 365 of 50 Shades of Grey. No, but people are ashamed to say that, but oftentimes there is fantasy in both partners' heads.
And she's not ashamed. So
she's really not.
She's verbalizing her fantasy, and I think that's...
So I guess if you're asking if there's something wrong with that, these two would say absolutely not.
Absolutely not. Both men and women oftentimes use sexual fantasy, like we were talking about the arousal continuum earlier. Pulling in a little bit of fantasy to help increase arousal is something people do, but again, they're very kind of ashamed to admit it. It does tend to take women a little bit longer than it takes men, and so maybe a little bit of extra foreplay can help. But yeah, there's nothing wrong or to be ashamed of with pulling in, something that excites you.
Okay. Jane, good morning, Jane.
Yes.
We're ready for your question.
Okay. I'm in a new relationship. We've been together for 3 months, but we've been living together for 2. He thinks he may have a testosterone problem because he has no interest in sex, but he wants interest, and he doesn't want to go to the doctor to find out. How can we find out?
Is it a libido problem? Does he have the desire?
He says he has no desire in having sex, is what she
Well, it's
said.
a simple test, the testosterone level, just to see if it's low, and he should discuss that with a urologist if it indeed is low. Testosterone therapy is very common now.
Yeah.
And it
we
does
see the
make a
commercials
difference.
for it.
And
you
it does
know?
make a big difference in some men. How old is he?
Of 40.
He.
He's
Yeah,
40.
He's
yeah.
40. And that's about the time that some men start to have lowering of their testosterone levels, and some men a certain level will affect them more than other men.
Yeah, but
But
you know, the
there's-
key is he doesn't want to go to the doctor.
Right.
So
I mean, there's really no other way to know for sure unless you get the blood test. You can look for some of the other symptoms of low testosterone, which is, you know, difficulty sleeping, hard time gaining muscle mass, maybe poor concentration, but those sorts of things can be symptoms of so many other issues. So it's a simple blood test, and there are lots of different options now available to treat it. You know, even making dietary and exercise changes can help as well.
Yeah. But knowing where you stand is
Right,
key.
you
And
have
so
to
many of us
know.
are afraid to figure that out, but that's
Right.
where your baseline should be, where you start from.
Yeah,
All right,
absolutely.
you two, thank you very much.
Thank
Thank
you
you.
for having us.
If you would like more information on certified sex therapist Emily Diallo's her practice, her therapy practice, or Dr. Rafael Diallo's OBGYN medical practice, just log on to our site at greatdayhouston.com and we will link you up. And don't forget to log on to Facebook and let us know how you say no to your significant other when you're just not in the mood. We'll share some of your comments later in the show. Honesty best policy, or is it okay to tell that little white lie so you don't hurt feelings?
I think most of the time it's just better to be honest.
Okay.
Yeah.
All right. My husband says, but you're honest too often. Okay. When we come back, one day they're superstars, the next they've been taken off the roster. Former Rockets NBA player and coach John Lucas found the silver lining in the cloud that almost ended his playing career. Find out how he's helping those fighting addiction to win in the game of life.